Heart disease is one of the leading causes of death worldwide. Yet many people ignore the early warning signs their bodies send. One reason is that heart symptoms are not always dramatic. They often begin with subtle changes that people dismiss as fatigue, stress, or normal aging. For example, someone may notice that they become tired more easily than before. Another person may feel mild discomfort in the chest during physical activity. Because these symptoms seem small, they are often ignored. The heart is an incredibly strong organ that works continuously throughout life. But when the cardiovascular system begins to struggle, the body usually sends signals. The problem is that these signals are not always obvious. Many people expect heart disease to appear suddenly with severe chest pain. But in reality, heart problems often develop slowly. The body may show early signs such as unusual fatigue, shortness of breath, or irregular heartbeats. Recognizing these early symptoms is important because early diagnosis allows doctors to treat problems before they become dangerous. Ignoring symptoms, on the other hand, allows damage to progress silently. Understanding what the body is trying to communicate can make a significant difference in protecting long-term heart health. When people think about heart symptoms, chest pain is usually the first thing that comes to mind. However, heart-related chest discomfort does not always feel like sharp pain. Many people describe it as pressure, heaviness, or tightness in the chest. Some feel a burning sensation or discomfort that spreads to the shoulders, arms, neck, or jaw. In some cases, the discomfort appears during physical activity and disappears with rest. This pattern may indicate that the heart muscle is not receiving enough oxygen during exertion. Another important point is that heart-related discomfort may not always occur in the center of the chest. Some individuals feel pain in the back, upper abdomen, or left arm. Because these symptoms vary so widely, many people do not immediately connect them with heart problems. Women in particular may experience less typical symptoms. Instead of severe chest pain, they may notice fatigue, nausea, or mild pressure. These differences sometimes delay diagnosis. Any persistent or unexplained chest discomfort should be taken seriously, especially if it appears during physical activity or emotional stress. Early evaluation can help determine whether the heart is involved. Another important symptom that people often overlook is shortness of breath. Many individuals assume that breathlessness simply means they are out of shape or tired. But in some cases, it may indicate that the heart is struggling to pump blood effectively. The heart and lungs work together to deliver oxygen to the body. When the heart cannot circulate blood efficiently, fluid may begin to accumulate in the lungs. This makes breathing more difficult, especially during physical activity. People may notice that climbing stairs or walking uphill suddenly feels much harder than before. Another warning sign is waking up at night feeling short of breath. Some individuals need to sit upright or open a window to breathe more comfortably. Shortness of breath may also appear together with fatigue or swelling in the legs. These symptoms can indicate early heart failure or other cardiovascular problems. Because breathing changes often develop gradually, they are easy to ignore. But recognizing these signals early allows doctors to evaluate heart function and begin treatment if necessary. Sometimes the heart sends warning signals through changes in rhythm. Many people occasionally feel their heart beating faster than usual. This sensation is called palpitations. In some cases, the heart may feel as if it is skipping a beat or suddenly beating very strongly. Occasional palpitations can happen to healthy people during stress, after caffeine, or during intense physical activity. However, frequent or unexplained palpitations may indicate that the heart's electrical system is not functioning normally. The heart normally beats in a regular rhythm controlled by electrical signals that travel through the heart muscle. If these signals become irregular, the heart may beat too fast, too slow, or unpredictably. Certain rhythm disturbances, such as atrial fibrillation, can increase the risk of stroke and other complications. Palpitations may be accompanied by dizziness, fatigue, or shortness of breath. These symptoms suggest that the heart may not be pumping blood as efficiently as it should. When irregular heartbeats occur frequently or last for long periods, medical evaluation is important. Monitoring the heart rhythm with electrocardiography or wearable monitors can help identify the underlying cause. Recognizing rhythm changes early helps doctors prevent more serious complications. Another symptom that may signal heart problems is swelling in the legs or ankles. This swelling is known as edema. It occurs when fluid accumulates in the tissues of the lower body. There are many possible causes of leg swelling, but one important cause is reduced heart function. When the heart cannot pump blood efficiently, circulation slows down. As a result, fluid may begin to collect in the tissues, especially in the legs and feet. People may notice that their shoes feel tighter or that their socks leave deeper marks on the skin. Swelling often becomes more noticeable at the end of the day after standing or sitting for long periods. Another sign may be weight gain caused by fluid retention. Edema related to heart problems often appears together with other symptoms such as fatigue or shortness of breath. The reason is that the heart's reduced pumping ability affects circulation throughout the body. Recognizing this symptom is important because it may indicate that the heart is under stress. Early treatment can improve circulation and reduce fluid buildup. Fatigue is one of the most common symptoms people experience. Because it is so common, it is often ignored. However, persistent fatigue may sometimes indicate that the heart is not supplying the body with enough oxygen-rich blood. The heart's main job is to pump blood that carries oxygen and nutrients to all tissues. When the heart becomes weaker, muscles and organs may receive less oxygen. As a result, everyday activities may suddenly feel more exhausting than before. A person may notice that walking short distances or climbing stairs causes unusual tiredness. Another sign may be the need to rest more often during normal daily tasks. Fatigue related to heart problems is often accompanied by other symptoms such as shortness of breath or swelling. These symptoms appear because the body is trying to compensate for reduced circulation. It is important to remember that fatigue alone does not necessarily mean heart disease. Many factors, including sleep quality, stress, and nutrition, influence energy levels. But when fatigue appears together with other cardiovascular symptoms, it should not be ignored. Paying attention to these changes can help detect heart problems at an earlier stage. Another symptom that may be connected to heart problems is dizziness. Many people experience occasional dizziness when standing up quickly or after physical exertion. In most cases, this is harmless. However, frequent or unexplained dizziness can sometimes indicate that the brain is not receiving enough blood flow. The heart is responsible for maintaining steady circulation throughout the body, including the brain. If the heart rhythm becomes irregular or the pumping function weakens, blood flow to the brain may temporarily decrease. This reduction in circulation can cause sensations such as lightheadedness, unsteadiness, or feeling faint. Some people describe it as a sudden wave of weakness or the feeling that they might lose consciousness. These episodes may occur during physical activity or even while resting. In certain cases, dizziness may be associated with heart rhythm disorders or significant drops in blood pressure. When dizziness occurs frequently, especially together with palpitations or chest discomfort, it should be evaluated by a healthcare professional. Monitoring heart rhythm and blood pressure can help identify whether the cardiovascular system is involved. Cold sweating is another symptom that sometimes accompanies heart problems. This type of sweating is different from normal sweating caused by heat or physical activity. It often appears suddenly and may be accompanied by weakness, nausea, or a feeling of anxiety. Cold sweat occurs when the nervous system reacts to stress in the body. During certain heart conditions, especially reduced blood flow to the heart muscle, the body may activate emergency signals. These signals stimulate sweat glands and cause the skin to feel cold and clammy. People experiencing this symptom may feel unusually weak or uncomfortable without understanding the reason. Cold sweating is sometimes reported during heart attacks, but it may also appear during other cardiovascular disturbances. When this symptom appears together with chest discomfort, shortness of breath, or dizziness, it should be taken seriously. Recognizing these warning signs early can be crucial for preventing severe complications. One of the most confusing aspects of heart symptoms is that the pain does not always appear directly in the chest. In many cases, heart-related discomfort spreads to other areas of the body. This phenomenon is known as referred pain. People may feel pain or discomfort in the left arm, shoulder, neck, jaw, or upper back. This happens because nerves that carry pain signals from the heart connect to similar nerve pathways in these areas. As a result, the brain may interpret the pain as coming from other parts of the body. Some individuals notice a dull ache in the arm during physical activity. Others may feel tightness in the neck or jaw without obvious chest pain. Because these symptoms do not seem directly related to the heart, they are often ignored. However, persistent or unexplained pain in these areas should be evaluated, especially if it appears during exertion or emotional stress. Understanding that heart symptoms can appear outside the chest helps people recognize warning signs earlier. One of the most important lessons in cardiovascular health is simple. The body often warns us before serious problems appear. Heart disease rarely begins suddenly without any signals. In many cases, the body provides early symptoms that something is not working normally. These signals may include fatigue, shortness of breath, irregular heartbeat, swelling in the legs, dizziness, or discomfort in the chest. Because these symptoms may appear mild at first, people often ignore them. However, early recognition can make a major difference. When heart problems are detected early, treatment options are usually more effective, and complications can often be prevented. Doctors can evaluate heart function, check blood vessels, and identify risk factors such as high blood pressure or high cholesterol. Lifestyle changes may also play an important role in protecting the heart. Healthy nutrition, regular physical activity, good sleep, and stress management all support cardiovascular health. Paying attention to the body's signals allows people to respond before a small problem becomes a serious one. Listening to these early warnings is one of the most powerful tools for protecting long-term heart health. The heart works continuously throughout life. It beats thousands of times every day, quietly supporting every organ in the body. Most of the time, we do not notice it at all. But when the cardiovascular system begins to struggle, the body may send signals that something is changing. These signals may appear as fatigue, unusual breathing, discomfort in the chest, or irregular heartbeats. Sometimes they seem small or easy to ignore. Yet these symptoms can be the body's way of asking for attention. Understanding these signs does not mean living in fear of every sensation. It simply means being aware of how the body communicates. Recognizing unusual changes and seeking medical advice when necessary helps protect the heart and the entire cardiovascular system. The most important message is simple. Your heart works for you every moment of your life. Listening to it may be one of the most important things you can do for your long-term health.